the case, and what we're going to do now is close the wound, but this is a very good demonstration of how you reduce a spondylolisthesis. The first thing we do is we go to the front of the spine, we take the disc out, and we replace the disc with I like to use a ring of bone because I believe bone heals better than synthetic material. And that ring of bone, what it does is it takes this bone, which was collapsed completely, and shifted forward about 50 to 75% when she was standing up, and it allows us to reduce that, which means push it back into place to some degree. The back of the bone at L5 is here, the back of the bone at S1 is here. You can see there's still a pretty big shift. But before surgery, this bone, the bottom of this bone was down here, and the back of this bone was way up here in the front. So now you see that there's a spacer in between, which is made out of bone at both levels. This one has pushed back a little bit. The disc is quite a bit taller now. This is a 14 millimeter graft. And then when we're done with that, we put plates over it so the graft can't shift forward, and we close the front. We go to the back and we put in screws, 2 screws at every level. These screws have a long head. What that allows me to do is put a rod in that head, and as we tighten the screw, it pulls this screw back in place. So you can see now that we're done, these are the grafts in the front. The back of the bone here now is right there. The back of this bone is right there, so they're almost perfectly aligned. And the screws coming in from the back to the front, L4, L5, S1, connected by a rod. So now she has a nice curve in her spine. She's reestablished the normal height of the disc. The nerve hole is open. We actually removed that broken bone that was pinching the nerves. So now the nerves down here are free, and everything looks nicely in line.